Okay, let's talk about something that can be, well, pretty scary: seeing some bleeding after an embryo transfer. It's a topic that brings up a ton of anxiety for sure. So, understanding what it might mean, or just as importantly, what it might not mean, is absolutely key. So, let's just dive right in and break it all down.
So you've just had your transfer, and then you see spotting. Ugh, your heart just drops, doesn't it? Your mind can start racing a million miles a minute with all the what ifs. It's such a moment of worry, but I want you to know you are so not alone in feeling that way.
I mean, that waiting period after the transfer is already one of the most stressful things ever, right? And then seeing some spotting can just feel like it cranks that stress up to 1,000. But here's the thing: it doesn't always mean the worst. So, our goal right now is to cut through the noise and just give you some clear, calm information to help you figure out what's going on. All right, first things first. What even is implantation bleeding? Let's get into the basics of what's actually happening inside your body. So, it's actually a totally natural thing. Think about it. That little embryo is trying to get all cozy and attach itself to the lining of your uterus. That lining is full of nutrients, and as the embryo snuggles in, which is a super important step, it can sometimes bump into some tiny little blood vessels. And what's the result? Well, you might see a little bit of spotting. Okay, so how do you know if that's what's happening? Well, there are some pretty specific clues to look for. Let's break them down. First, the timing. This usually happens around 5 to 10 days after a day 5 transfer. Then there's the color, and this one's a big deal. It's typically a light pink or even a brownish color. Think old blood, not that bright red you'd see with a period. And look at the amount and how long it lasts. We're talking super light, maybe just a few drops, and it's over pretty quick, like a few hours or maybe a day or two tops. But, of course, the million-dollar question is this implantation bleeding or is it something else? So let's do a little side-by-side comparison to help you tell the difference. All right, the first and most common mix-up is with your period. And you can see here the differences are pretty stark when you put them next to each other. Implantation spotting is just that, spotting. It's minimal. A period, on the other hand, starts light and then gets heavier. The color's another big clue: pink or brown for implantation versus that bright or dark red for a period. And maybe the biggest giveaway? The timing. Implantation spotting shows up before you'd even expect your period to start. Now, there's another thing that can happen, especially with IVF pregnancies, called a subchorionic hematoma, or SCH for short. It sounds complicated, but it's basically just a little pool of blood that collects near the gestational sac. The key things to notice here are that it usually happens a bit later, maybe around 6 to 9 weeks, and the bleeding can actually be heavier. But here's the most important part: you wouldn't know you have one for sure without an ultrasound. Only a scan can diagnose it. Okay, now we have to talk about the one that's everyone's biggest fear. And it's important to know that bleeding from a miscarriage is, well, it's very different. It's not just spotting. It's usually heavy bleeding that continues and even gets worse. The color is almost always bright red. And this is key: it's typically paired with other things like really strong cramps, back pain, and maybe even passing clots. It's that combination of heavy, worsening bleeding and pain that's the real signal that something more serious could be going on. So, just to give you a little perspective on all this, how common is this, really? Well, according to the American Pregnancy Association, about a third of all women have some kind of light spotting in early pregnancy. So, if it happens to you, you are definitely in good company. It's a pretty common thing. And this right here is probably the most important thing I'm going to say, so please listen closely. Implantation bleeding can be a good sign. It can be normal, but it is not a guarantee of pregnancy. And on the flip side, and this is just as important, not having any spotting doesn't mean it failed. So many successful pregnancies happen with absolutely zero spotting. Zero. Okay, so now that we have all this info, what do you actually do? What's the plan? Let's talk about the specific signs that mean you need to pick up the phone and call your doctor's office. All right, these are the don't wait, call your clinic right away signs. If you have heavy bleeding, and by heavy we mean soaking a pad in an hour, or if you have severe pain, especially if it's just on one side, you need to call. Same goes for passing any clots or tissue. And look out for other things too, like feeling dizzy or faint, having pain in your shoulder, or running a fever. Look, it's always smart to let your clinic know about any spotting, but if you have these symptoms, that's an immediate phone call. Whew, okay, that was a lot of information, I know, so let's just take a breath and recap. We're going to boil it all down to the most important things you need to remember as you go through this.
Okay, here are your 4 big takeaways. Number 1, remember the signs of true implantation bleeding. It's typically light, it's short, and it's that pinkish brown color. Number 2, and I'll say it again because it's so important, it is not a guarantee. Having it or not having it doesn't confirm anything. Number 3, just remember there can be other reasons for bleeding, right? Like an SCH or a miscarriage. That's why letting your doctor know is always the right move. And finally, number 4, the only things that give you a real, definitive answer are that HCG blood test and, later on, an ultrasound. That's it.
And please, if you take away nothing else, take away this. It's so easy to get caught up in symptom spotting and think that because you have no bleeding that it's a bad sign. It is not. A pregnancy with absolutely zero spotting is just as normal, just as common as one that has a little. You know, this whole journey, especially that waiting period, is just filled with so much uncertainty. But the hope is that by arming yourself with some clear knowledge, you can feel a little less anxious and a little more in control. And in a journey like this, isn't that really the best we can ask for?